Yes. I am concerned about Congress exempting themselves from bills, from the bill. It's written into the bill, they would exempt themselves in some of those 12 different bills that they got. I am concerned about the government running this on a panel of doctors who can make those choices for you.
Great, thank you, Eric. And I want to thank you for your service too. We haven't had any Navy folks up yet, so I don't like to show my preference. Glad to see you. Let me talk about a couple of things. One is that included in this proposed House bill, and again, I'm not defending H.R. 3200, I'm just letting you know what exists in the bill, is financial assistance to help doctors that are going to be providing care in underserved areas like here in Cochise County. And I look at our leadership here and the challenges that we face, because another aspect of the holdout, the Blue Dogs, was to make sure that the Medicare reimbursement rates were more than they currently are in rural areas compared to the urban areas. We wonder why we don't have doctors and nurses out in rural America. It's because they don't make as much money. They can't make as much money out in rural America. And a lot of Blue Dogs come from rural areas. So I'm really pleased that that was included in one of the compromises in order to move the bill forward. I don't think that the financial benefits are quite where they need to be. We see fewer and fewer doctors going, or students becoming doctors, particularly in the primary physician area. Doctors make quite a bit of money in the specialty area, we all know that. But the general practitioner, the general physician, is not making enough money, we see, in this day and age. And particularly, Eric brought up the issue of tort reform.
Yes.
I have voted for tort reform in the past, and I will vote for tort reform again. I think that we cannot have a discussion about healthcare reform in a piecemeal way where we don't discuss a very critical aspect to healthcare reform, which is defensive medicine. I'm pretty close to my healthcare community, and I've heard time and time again about how doctors are needing to order more tests, more lab work, more MRIs, because they're worried about getting sued. So not to include tort reform in this legislation is a big mistake. I'm going to let folks know that. I have let folks know that. And I think that in order to speak out about this aspect, we will be able to get a substantive piece of legislation included in a final version of a bill. So I appreciate that aspect as well. Congress does not exempt itself at all from the plans that are being offered. Like I said, I am just like any other federal employee, and my promise to you is that I will fight to make sure that whatever plans, whatever cafeteria-style programs available in this change is the exact same plans and options at the same costs that are going to be available to the American people. You will get what I get from any other member of Congress gets. That's my promise to you. That's what I'm going to fight for. Now, the death panels is something that I hope that we've gotten to a point through the media and other aspects to know that this should be completely debunked. There is not a death panel out there of folks sitting around deciding how to euthanize our seniors, our parents, and our grandparents. Maybe you don't like some of your relatives, but that's not the way to think that we're going to deal with the problem. You're going to have to calm down a little bit, because Eric brought up a lot of questions, and death panels is one of them, and I want to make sure that we address this. Again, this is an option. If you have aging relatives, if you want, you should be able to sit down with your physician and talk about end-of-life choice. If you want. If you don't want to, you don't have to. And this availability has been around for 20 years in statute. It's something we all know has existed, something that is advised upon, but if you don't want to, you don't have to. So forget about the death panels. It's something that's simply not true. All right, next question.
Yes, ma'am. My name is Richard Thomas. My problem with it is with Ms. Pelosi and Mr. Reed, you will have what has been reported. You will have this health care. You do not have a choice. This is what we give to you. You don't have a choice. I'm sorry to say, ma'am, I have a choice. The VA takes care of me. 3.5, and they take care of me very good, ladies and gentlemen. 3.5 years ago, I was diagnosed with cancer. Within 2 weeks, I had it cut out, and I'm fine. On the 15th of this month, I was sitting in their emergency room with a massive heart attack. I died twice on the table for them bringing me back. So I figured that the VA has done an extremely good job for me. And I certainly don't need some person from California or Nevada telling me I can't have this. The big point of it is you brought it up yourself, is tort reform. These doctors are being sued by some ambulance chaser